Hello and welcome to webinar series from Happiest Health. Happiest Health is a health and wellness knowledge enterprise which will bring you a series of webinars on various health topics.
I am Kumaran P, and I will be your host for today's session on increasing the life of having Parkinson's. Parkinson's disease is the second most common neurodegenerative disorder, observed only less than Alzheimer's disease, which is characterized by progressive motor symptoms over time. In recent years, Parkinson's disease has undergone the fastest growth in prevalence and disability among neurological disorders, and it has become one of the leading causes of disability worldwide. The Global Burden of Disease, GBD, study reported that incident cases of this disease were 1.02 million in 2017. There were 6.1 million people reported in 2016 globally, and the age standardized rate, ASR, of prevalence increased by 21.7% from 1990 to 2016. Studies predicted that the burden of PD would grow substantially in the future decades. For example, it was estimated that there would be 4.94 million people with Parkinson's in China by 2030, which would account for half of the total people with Parkinson's worldwide. The rapid development of PD has placed a substantial burden on society, individuals, and health systems. Especially, the disability caused by PD dramatically reduced individuals' health-related quality of life and placed substantial expenses on health systems, including the drug, rehabilitation, and caregiving. Today, we have with us a panel of three members to give us more insight into this health condition and how people can increase their quality of life having Parkinson's. To introduce our panel members today, we have with us Dr. Pramod Kumar Pal, Professor of Neurology, Movement Disorder Specialist, Program Director of Movements Disorders Fellowship Program at the National Institute of Mental Health and Neurosciences, NIMHANS, Bengaluru. Dr. Pramod Pal joined as Clinical Fellow in Movement Disorders at the Neurodegenerative Disorders Center, Vancouver, Canada, and later obtained further training as a clinical fellow in electrophysiology in movement disorders, human motor control, and transcranial magnetic stimulation at Toronto Western Hospital, Toronto, Canada. His areas of interest are Parkinson's disease, dystonias, essential tremor, Parkinson plus disorders, rare movement disorders, functional movement disorders, spinocerebellar ataxias, human motor physiology, and transcranial magnetic stimulation, advanced neuroimaging, and cognition in movement disorders. He mentors several DM and PhD students in neurology and has 380 publications in national and international journals and books with a H index of 46. Dr. Pal is also founding secretary of the Movement Disorder Society of India, past and treasurer of Indian Academy of Neurology, past secretary of the MDAOS, and past secretary of Neuromodulation Society of India. Currently, he is the president of the Parkinson's Disease Society of Karnataka and editor-in-chief, Annals of Movement Disorders, chair of the Infected Related Movement Disorder Study Group, and vice chancellor, vice chair of the Education Committee of the International Parkinson and Movement Disorder Society. Member of the committee IAPRD, he also serves as member of the Rare Movement Disorder Study Group, Rating Scales Education and Training Program Committee, and Neurophysiology Task Force of IPMDS. Movement Disorders in Asia Task Force, Post-Stroke Movement Disorders Study Group, Parkinson's Research Alliance of India, and the Rare Movement Disorders Consortium of India. We welcome you, Dr. Pal, for giving us this time and this opportunity to have you with us.
Thank you.
Our next panelist is Dr. Sujit Overlap, an eminent neurologist with postdoctoral training in movement disorders, has more than 15 years of experience as a neurologist. He did specialized training in Parkinson's disease and deep brain stimulation at the University of British Columbia, Canada. His areas of interest include Parkinson's disease, DBS, botulinum, toxic therapy, and treatment of other movement disorders, including tremor, dystonia, tics, ataxia, and chorea. He has written 3 textbooks, several book chapters, and several national and international publications to his credit. He's been invited speaker for the National Movement Disorder Society for the last several years and the International Parkinson's and Movement Disorder Societies meet. He is the founding member of the Movement Disorder Society of India, editorial board member of the Annals of Movement Disorders Journal, and is currently serving as the bylaw committee member of the International Parkinson's and Movement Disorder Society. He has been a mentor for students of the University of Gothenburg, Sweden. We welcome you, sir, for having me. Our next panelist, Mr. Rajeev K. Gupta, is a retired aircraft designer and an IT professional. He was diagnosed with Parkinson's at the age of 51 in 2013. He opted for and underwent deep brain stimulation surgery in 2018. He is the author of the book Destination Unknown, My Journey with Parkinson's, and he is the first Indian patient to share his experience of living with Parkinson's. We welcome you, Mr. Gupta. Without further ado, we will move on to the discussion. I would like to start with Dr. Pramod. Doctor, what are the telltale symptoms of Parkinson's? Is it true that the muscle twitching, spasms, cramps in the feet are early signs of the disease?
Yeah, so thank you, Mr. Kumaran, for the kind introduction. So the Parkinson's disease, the main signs or the symptoms or the clinical manifestations are tremor of one of the hands at rest, most often in the hands and one part of the body. Sometimes it can be in the leg. So it is at a rest. That means the shaking of the hand when the patient keeps the hand at rest. Then a slowness of movements. So he takes much more time to do the normal work what he used to do earlier. Slowing of the handwriting, it is called a micrographia. Then the loss of voice, volume, reduced facial expression. So these are the characteristics of slowness. Then the other most important sign is the stiffness. So one part of the body, especially one hand, the side which is affected first. In Parkinson's disease, most often one side is affected more than the other, and one side starts earlier than the other side. And this continues throughout the course of the Parkinson's disease. So they develop a stiffness, which is technically termed as rigidity. And the fourth problem, which develops later on, is difficulty in walking, short steps. There are fascination gait. That is the patient is trying to, cannot control himself and he just runs forward. Or there could be later stages, postural instability, that is difficulty in maintaining a balance. He tends to fall usually forwards, and sometimes they can have other gait problems or difficulty in walking, like suddenly they stop, cannot take a step forward. This is called a freezing of gait. So these are the main four cardinal symptoms of Parkinson's disease. They can appear, at least the first three, in various combinations in the initial part of Parkinson's disease. Now, you have asked a very important question that what are the very early signs of so-called, non-specific signs? We call it non-specific signs of Parkinson's disease. You may not have all whatever the signs I've just told you, you may not have that. So these symptoms of early Parkinson's disease, now we very well know that Parkinson's disease starts almost 20 to 30 years before the actual symptoms which I have described. It can be in the motor symptoms, which I told you, that is the movement-related symptoms, or there could be a spectrum of non-motor symptoms related to the mind and psychiatric problems, etc. Okay, so these early symptoms may be very non-specific, and it depends on the occupation of the patient or the lifestyle of the patient. It can, sometimes start as a loss of energy, easy fatigability, depression, sometimes like a muscle cramps or vague sensory symptoms. But these are it can be confused with many other neurological disorders. Then always a doubt occurs, it is an elderly person, is it related to aging? And yes, in the very early stage of Parkinson's disease, you can mistake as a normal aging also. Then you can have some dragging of the feet after walking for some time, clumsiness of the hand. As I told you, a micrographia, that is you start writing big letters and then gradually it becomes smaller and smaller. Sometimes, those who are singers, it may be related to the occupation. Those who are singers, they may complain that, at the high pitch, their voice becomes very, soft and they cannot produce the normal tone of the voice. Then you can have sleep disturbances, bad dreams. They are these are called non-motor symptoms, depression. They scream out in the sleep. That is called REM-wave disorder of sleep. So these are the prodromal features of the non-motor symptoms of Parkinson's, motor symptoms before the starting of the motor symptoms. And finally, it may be sometimes a change in personality, constipation, loss of smell, these may, occur before the motor symptoms. So this is in a nutshell, what are the very early symptoms, or
Right.
these are the symptoms which can start before the motor symptoms.
Right. Okay. Thank you, Doctor. Dr. Sujit, I'll come to you. How can the life or the quality of life of the affected person be improved? What measures someone can be taken, the family can take to help the people?
See, the quality of can be improved in two methods. Mainly, the motor symptoms are contributing to the major disability. Then the non-motor symptoms.
Right.
Motor symptoms are mainly the slowness, the tremor, stiffness, imbalance. So mostly these are medications that are helpful for improving the motor symptoms. Tremor can be controlled by anticholinergics. Then the disease advance, the rigidity become problem. The stiffness can be controlled by several drugs, dopamine agonists. Then there is levodopa. The motor symptoms are the most disabling in the initial phases. Then exercise and physiotherapy can, to some extent, help with the motor symptoms, especially the balance, falls, all this. The non-motor symptoms, sleep disturbances, many a times will require medicines, and up to 45% of people are affected with depression. So you may require antidepressants and sometimes counseling. And so social support is very important, especially family support is very important, because patients have major disability with the movement. They have so many psychological issues, psychiatric issues. So caregiver support and family support is very important in order to improve the quality of life in these patients.
Right. Thank you, Dr. Sujit. I'll come to Mr. Rajeev. Rajeev, tell us about your journey with Parkinson's. When did you initially start having symptoms, and how have you been able to manage the condition now?
Yes, Kumaran,
Yeah.
my voice has become a little weak and a little wobbly. You'll have to bear with that.
No problem, Mr. Rajeev. We completely understand, and I think you can go ahead.
Yeah, so I started getting the first signs of something going wrong in 2012, actually. My left hand stopped swinging when I was walking, and lifting the left hand became a little difficult. I was into IT profession, and typically in IT, you think it's some very common malaise is there, which is called RSI, repeated stress injury. First, I thought it is RSI, so I took care of all the ergonomics and all that, but it didn't help. Afterwards, I thought it's some frozen shoulder. I did not consult a doctor yet. So I went for physiotherapy, and it seemed to help for some time, but afterwards again I started getting the symptom. Finally, after a year or so, the first time I consulted an orthopedic, and that orthopedic, after some tests and X-rays and all that, he referred me to a neurologist, and that neurologist confirmed that, I may be having what's called Parkinsonism, which may lead to Parkinson's. So in November 2013, I was diagnosed with Parkinson's, and it was confirmed through clinical evaluation, because there is no other biological marker that confirms Parkinson's. For some time it was managed well with the gold standard Syndopa or the levodopa carbidopa combination, and I almost forgot about Parkinson's.
Okay.
But then the dosage of the medicine were to be increased, and I started getting dyskinesia.
Okay.
And the on time started reducing, and off time started increasing, and sometimes during the off time it became difficult to drive also, and it started affecting my work in the office also. So
Okay.
that is the time the doctor put the thought of DBS or deep brain stimulation in my mind, and that's when I started thinking of it. So 2-3 years down the line, in 2018, November 2018, I opted for DBS, and after that, I had been quite stable with a continuous on time and no dyskinesia and all that, So I'm living a near normal life, but of late some balance should come, but otherwise I'm really living near normal life. I can't say totally normal, but near normal life I'm living.
Right.
Yeah.
Okay. Dr. I'll come back to you, Mr. Rajeev. So we understand that how you were an IT professional, and then certain early symptoms, like what Dr. Pramod Pal actually pointed out to us on this entire occasion. So I'll come back to Dr. Pramod again. Doctor, do you see a delay in persons with Parkinson's seeking treatment only when their symptoms get worsened? Also, do you see a time lag between the initial symptoms seen and the time when the treatment is sought? If so, it is because of the tremors and the movement slowness is seen as a process of aging and they ignore it. So, by the affected person or the family. So if you can give us some inputs on this delay in people coming to treatments.
So yeah, what you have said is correct. That early detection of Parkinson's disease is also a dilemma for even a very seasoned movement disorder specialist. Okay, and we can be wrong. And there is nothing like delay in starting a treatment for a disease which is there is no cure for that. And if you do not treat in the initial stages, I don't think there will be much harm. Okay. It is not like high blood pressure or diabetes or heart disease, where if you do not start the treatment immediately, there could be collateral damage and the other problems can occur. So it is very well known. We see when the patients come to a tertiary care hospital like our hospital, at an average, they come after about 2 years to 3 years after the onset of the problems, like either mainly the motor problems, like shaking of the hand and difficulty in writing. So by that time, they had already seen maybe another doctors in the community, which within a few months so these all depends on the level of education, level of awareness, level of public, canvassing or media to detect, make them aware of the early symptoms of Parkinson's disease. Yes, it is very important that the community, the relatives, everyone understands what are the early symptoms, but there is always a high chance of mistaking some other disease for Parkinson's disease. And in the initial stages, even as Mr. Rajeev has told, that there could be only diagnosis of Parkinsonism and nothing else. Okay. So at that moment, we always give the patient an option whether to treat or not to treat. If a person is retired, he has a problems in the left side of the body, which is the non-dominant person in most of the people, and it does not much interfere except some social problem, then we advise that you no need to take medical treatment. You can do physiotherapy, just balance, yoga, etc., and lead a good life. It is not every patient's treatment has to be customized. It is a tailor-made. Today, I may develop a shaking, another person may develop the progress maybe in a different way, different trajectory. So we advise that only those who have a problem in continuing with the daily activities, or is a social nuisance, or there are some other comorbidities like, always the patient keeps the hand stiff. So if the patient is a diabetes also, there could be high chance of developing frozen shoulder. So in these circumstances, yes, there is need for treatment early to reduce the stiffness and the shaking of the hand and start treatment. But there is nothing like, delay in the initial stages. It doesn't harm the person in a patient of Parkinson's disease. Okay.
Got it. I'll come back to you, doctor, on when do someone have to come to you, or when do someone has to diagnose. I'll come back to that question a little later. I'll come to Dr. Sujith. Does Parkinson's affect the memory of the individual affected? In that case, can the treatment available currently help the patient regain the memory?
Yes, Parkinson is one of the causes of dementia. About 15 to 20% of Parkinson patients later on develop dementia. It's usually a late feature, but even mild memory impairment you can see in the initial phases itself. So this can be helped with the drugs that are used in Alzheimer's itself, and those are helpful. but not to like full extent. They will partially relieve the memory deficit. And not only that, the levodopa itself that is given for Parkinson, dopamine supplement, also help with the memory.
Okay. So, Dr. Rajeev, Dr. Pramod. So, when we come to this particular question, is it curable? This is something that we've always been asking. Is Parkinson's disease curable? Because we have with us Mr. Rajeev K. Gupta, who has bounced back to life despite struggles with Parkinson's. So, what are your views, Doctor, on this?
So I'll tell you one analogy of what is cure. Okay. So if in one sentence I'll say the Parkinson's disease as of now is not curable. Okay, but it's treatable. It is treatable.
Okay.
And it is just an analog like a person has a fever. If we do not know the cause, we just give symptomatic treatment, so-called symptomatic treatment to reduce the fever, like paracetamol, crocin, etc. Fever comes down. But if there we find an underlying cause like pneumonia, we treat with antibiotics, and that is treatable, that is curable. Okay. So similarly in Parkinson's disease as such, we do not know the cause of Parkinson's disease in most of the patients, though they'll come later on. And even if there's a cause, when there's a cause for Parkinson's disease in the classical sense, like there's a small tumor in the brain, or because of some infection has happened, or because of some medications included, cause the Parkinson, that we do not say as a Parkinson's disease. We say Parkinsonism or a secondary Parkinsonism, okay? Secondary Parkinson's disease. In that sense, those diseases are curable by some operations are there for a disease called normal pressure hydrocephalus, where exactly they may mimic like a Parkinson's disease, but not a Parkinson's disease. So as such, as of now, there is no specific treatment advocated in the world to cure Parkinson's disease, but it is definitely treatable.
Okay, so when you say this, if there's no cure, but there is a treatable procedures for Parkinson's disease. So, doctor, what are the risk factors associated with Parkinson's disease for that matter?
So many epidemiological studies has been done, and it is still ongoing. And one thing which comes out, first of all, in one sentence, we really do not know what are the real risk factors for Parkinson's disease. But yes, in the epidemiological studies, we found that those who are aged population, the age of the patient is one of the risk factors. In Western countries, the mean age of onset of the so-called motor problems is about 58 years. But in our country, it is much higher, much lower. It is about 52 to 53 years. So we have a earlier age of onset of Parkinson's disease. But in general, as the longevity increases, the prevalence or the finding of Parkinson's disease in the community is much more. Okay. So this could be age, can be a risk factors. Second thing is that the male people, the men, are more likely to get Parkinson's disease than the women. Though this has been, we see in our hospital setup in a tertiary care center, almost 60% of the patients who come to our hospital are men, 40% are approximately women, 30 to 40%. But this could be a bias also, because women do not come to the hospital because of the customary taboo, etc., and they get less attention. But still, maybe a gender bias is there. There probably definitely the men are more susceptible to Parkinson's disease than female. Then the next few things are in court that's still under investigation. The environmental factors and genetic. Genetic factors definitely has come in a major way, and approximately if you take all the Parkinson's disease, maybe around 10 to 12% or the 15% of the patients can say that yes, one of my parents had developed Parkinson's disease, or one of my brothers or sisters has Parkinson's disease in a different way. So we have now increasingly finding that certain genes are abnormal, or abnormal genes are there, especially in patients of young onset Parkinson's disease, those who develop the Parkinson's disease less than 45 years or less than 40 years. So in that way, if you have that particular gene, probably you may develop a Parkinson's disease later in life. And finally, the environment. So there are a lot of studies going on, and it has been said that probably toxins in the environment, pollution in the well water or water we drink, in the food, that can cause Parkinsonism. Or it could be those who had exposure to manganese, those who are worked in iron ores, manganese ore, they develop a Parkinsonism type of phenomenon. But these again are secondary Parkinsonism. But there is always things that probably over lifetime we are ingesting, or our body is getting challenged with a lot of toxins in the body. And we should have a very good system in the body, like a genetic system, to get rid of the toxins from the body. If our genetic system is problematic, or I have had gene which is liable to cause problems in driving away the toxins from the body, I may have a more susceptibility to develop Parkinson's disease in spite of having the same type of normal exposure to toxins than a person who is genetically competent. Okay, so what we come to what is known as gene environment interaction. So you are genetically predisposed, and you are again going into an environment which has a lot of toxins. Okay, so these are the things. These are the 4 risk factors which I can tell. So this is the way. Yeah.
Okay. Thank you for sharing these interesting risk factors, Doctor. Dr. Sujith, it is said that the deep brain stimulation therapy, or the DBS therapy that is largely known as, is the most sought after treatment for Parkinson's. Tell us more about it. At what stage a person with Parkinson's is suggested to undergo DBS or the deep brain stimulation?
We generally consider DBS when the motor symptoms are not very well controlled with drugs. Usually they have more of off periods and shortening of on period and marked dyskinesia with drugs. This is the time when we ask the patient to undergo DBS. In generally, we select patients after 5 years of onset of, but will vary depending. We have an assessment system by which we see how much they improve with levodopa. A 30% improvement in the score in levodopa, that will tell you a good prognosis after DBS. So generally, it is the complication that patient on drugs and when they are not working properly, it is the ideal time for DBS. What we do here is we are placing a pacemaker that is being controlled from outside, a battery that is kept in the near the clavicle, that is the collarbone, and a small wire is connected to it, to the subthalamic nucleus, mostly in Parkinson. There are other targets also. So we initially introduce some 5 electrodes on either side, and we select the best one by seeing with small voltage which works best. And only that one is kept and the other 4 are removed, and we then place a permanent lead through that. That is connected to this battery, where we can adjust the voltage, amplitude, pulse width. 3 parameters can be adjusted. And we can do it externally. So we find out the best suitable voltage for the patient, which best suitable amplitude, like that.
Right.
Small voltage being given to the basal ganglia region, which improves mainly the motor symptoms and somewhat non-motor symptoms also.
Right. Okay. Mr. Rajeev, we understand that you've gone through DBS. You've gone through DBS. Could you share us some insights on how did it go, and how was it, and what are you seeing before the surgery and the after the DBS therapy, for that matter?
So, as Dr. Sujith was explaining, so for me also an assessment was done. And after the assessment, I was told that I can expect around 60% improvement in my motor movement. But I think I got around 85 to 90% improvement in my movement. So to some, I think I gained a lot from DBS. Also, my on time is now, more smooth, than off times are very rare and very mild off times I get that.
Okay.
So some of the daily functions like, driving and walking at time according to the medicines earlier. Now I can drive or, I can walk at any point of time the day. That itself is a big improvement. But having said that, I think there's a lot of, sometimes people get negative reports about DBS.
Right.
But the one reason for that is, I think, the unrealistic expectations. As Dr. Sujith was telling, DBS is not the cure all. Like most of the non-motor symptoms are not improved by DBS. People should understand that.
Okay.
And also the post DBS, there is a procedure called electromodulation.
Okay.
Then they set the parameters, and it's a mixture of art and science. I mean, it's an iterative process. For some people, if you're lucky enough, your iterative process may end after 4 sittings or 4 or 5 sessions.
Mm.
Some people may take even more number of sessions before they get the optimized settings for that.
Okay.
So some people start telling the doctor, I don't know how to do it, and I'm still not getting the benefit and all that. I think we have to show some patience there, and give the right feedback to the doctor after each change in settings, and it's a teamwork between the doctor and the patient.
Mm. Mm.
So if we do that, I think what I understand, it's a fairly safe procedure right now, and with a high success rate.
Okay.
And since I benefited from it, so I enthusiastically recommend it to everyone, who can afford to go for it, and who is selected as after the initial prognosis, as Dr. Sujit was mentioning, who is selected as the right candidate or DBS. I think they should opt for it.
Right. Right. Okay. Okay. Thank you. Thank you, Rajeev. I'll just come back to you. I was also very keen to understand, Dr. Pramod. Can you tell us something more about surgical treatments other than DBS? Because there have been other alternative treatments, but then what are the other surgical treatments other than DBS?
So, as Mr. Rajeev rightly pointed out, that DBS is one of the most, valuable treatment nowadays for sought after also for the Parkinson's disease. And apart from art and science, I will also say that the outcome also depends on the luck of the patient and experience of the doctors. Okay.
Okay. Okay.
DBS. Now, before DBS, there are a lot of surgical treatments started for Parkinson's disease, and still it is going on because DBS, if we recommend surgical treatment for say 100 patients of Parkinson's disease in our center, maybe only 10 can afford DBS, not more than that. Affordability is really a problem in India. So there are certain treatment called lesional surgeries for Parkinson's disease. So here DBS, what it does is that it introduces a lead in a certain area of the brain called nuclei, and it just stimulates, and it does not cause a permanent damage of that particular area. So it is so-called, it's a reversible. If you can take it out, it will not damage permanently that area of the brain. But there are patients where it has come with a certain, say, severe tremor of one hand. Okay. So there's a procedure called a thalamotomy, a particular area of the brain called thalamus, more specifically the VIM. Okay, the opposite side, suppose I have a tremor on the right hand, I need to operate on the left side of the brain. And left side thalamus, if it is targeted, even we do DBS for that also for other types of tremor, but a lesional surgery, it permanently damages certain area of that particular thalamus, and it completely destroys. The main thing is that we have learned from our experience from other type of tremors that probably there's a very severe overactivity and is a disordered activity of the particular thalamus, which causes the shaking. So in patients of Parkinson's also, those who have a very severe tremor on one side, we offer them this lesional, so-called lesional surgery of thalamotomy. It can be a direct surgical treatment by giving extreme heat and coagulating that area, or it could be by gamma knife or by HIFUX. Okay, so these can be targeted in a different way, but it can be done only on one side. Usually it is safe only on doing on one side. It cannot be both sides, because both sides, if you do lesional surgery, there could be some problems later on. Okay, and by and large it is safe, and improvement is very dramatic in most of the patients. The tremor comes down a lot, and the cost is very less in our NIMHANS. Sometimes for the poor patients we can do in 5,000-6,000 of rupees, otherwise around 20,000 to 30,000. Then there is another treatment for so-called lesional surgery is called peridotomy. Okay, so the patients who have what Mr. Rajeev was alluding to, the dyskinesias. So after 5 or 6 years, when you develop so-called coriform movement, dancing movements of the body as soon as you take the medicines. So this is sometimes more problem on one side of the body. In the same way, instead of thalamotomy, we do for the dyskinesias a peridotomy. There is another nucleus is there called GPI, globus pallidus internus. We again damage that area of the brain and do peridotomy. These are all additional surgeries. So these are very important, and it is used extensively in developing countries like India, where patients may not be able to afford deep brain stimulation. So they are the major ones. There are also parallel thalamotractotomy by hypoxic surgery, etc., high frequency MRI guided ultrasound. Those are very costly. The cost may be ranging up to sometimes for DBS also. What are the costs? It can be like that. Okay. So these are the surgical treatments as of now available for Parkinson's disease, apart from DBS.
Right. Doctor, we talked about symptoms, we talked about risk factors, causes, and some of the treatment procedures. But this particular question, I really want to raise it to both of you, Dr. Sujith and Dr. Pramod Pal. One of the collateral damages caused by the COVID pandemic was the discontinuation of treatment. Follow for many suffering from chronic illness, including those suffering from Parkinson's disease. Do you see anything worsening of the symptoms among these affected by Parkinson's in the last 2 years? Because both of you are in two different regions, and what do you see, Dr. Sujith? First, I'll go with you, and then come back to Dr. Pal. And yeah,
many patients have stopped coming to doctors because of COVID, and definitely there is worsening of the symptoms, because sometimes they have developed fixed contractures but not taking medicine. And we don't know how far the COVID has contributed to it. It's very quite difficult to assess, because generally the Parkinson is a disease which progresses naturally. So it may be the natural progression, but some patients are affected with COVID also. But COVID is said to worsen the motor symptoms of Parkinson's disease. And we have seen several patients I have seen with fixed contraction, because they have stopped taking the drugs. They are not seeing doctors. So they have definitely worsened, probably because of the treatment being not done.
Given.
Yeah.
Right. Okay. Dr. Pal, so you were talking about the treatments in NIMHANS and one of the premier institutes for mental illness and mental health. So how have you seen, because COVID has been havoc created?
So, as Sujith has rightly pointed out, all depends on availability of the medicines, and those fortunate patients who were able to procure the medicine did not suffer anything actually. Okay. So even now I am getting the patients after 2 years, 3 years, they said that they were able to regularly take the medicines. We had given a lot of consultation as soon as the first pandemic started in 2020. So we started, the patients stopped coming in the hospitals, and we had started a IVRS system where they used to call us over the phone, and we used to guide them if the patients are having any problems related, because Parkinson's disease, the medicines itself can cause problem. So we were guiding them some dose adjustments, and later on we did some of the video consultations, teleconsultations for these patients. But yes, the thing is that if you do not get the medicine, you cannot do anything. You have to give the right medicine at the right time. So that is one aspect. We have seen patients who have come. See, we have talked about the deep brain stimulation. Now, the pacemaker is the life, it is not a permanent battery. So we have seen a crisis, the deep brain stimulation crisis within a crisis of COVID. The patient was admitted because the battery had stopped. So they were not able to come to the hospital. Battery had stopped. And when the battery stops, sometimes it is a nightmare for the patients and the relatives. So these are the patients were affected because of the stoppage of the battery, drainage of the battery. They could not change in the right time. The third thing which has happened is that, see, in India, it is not like a Western country where there is a nuclear family or patients are staying alone or with a very elderly caregiver. We are fortunate in that way that there are a lot of people in the house to take care of patients. Okay. And in that way, the burden of, the falls, etc., because the people were all confined in the lockdown to the house, even their children, their spouses, as well as the relatives. So there were sometimes some patients said that they had a better care actually at home during the lockdown period. If they had got the medicine, the emotional care of the patient sometimes has improved. And that was a positive aspect of a more closely knit family giving a support to the patients of Parkinson's disease. There was also a reverse where the patients were staying isolated and they developed a lot of hallucinations, psychiatric problems, depressions. So it all depended. The COVID pandemic, it was such a way that it has taught the doctors, patients, caregivers how to take care of the patients.
Right. Rightly put, Doctor. Rajeev, how was it for you during the COVID pandemic? Everything was okay. What about your procurements of medicines, like what Dr. Pal was telling? So how was it for you, Mr. Rajeev?
So, I am one of the lucky ones to stay in a metro city like Bangalore. So, and, with access to the network and technology and all and online orders, etc. So, we did not face any problem whatsoever because of COVID in terms
Okay.
of procuring medicines and all. Yeah. But I do understand that there will be large parts in our country where it can be become a challenge. In big places like Bangalore and all, there was no issue.
Right. Okay. Rajiv, the next question that I really wanted to ask you, you have been interacting with many who are sailing on the same boat, I'm sure, as you. How do you motivate them? What are their major struggles in everyday living? So, how do you keep yourself motivated? How do you motivate others? Apart from writing your book, Destination Unknown: My Journey with Parkinson's, how does this entire ecosystem works, Rajiv?
Yeah. So again, it's very subjective, that
Okay.
depending upon the age and the circumstances of a person,
Mm.
what are their priorities in life and how much is their disease advanced.
Okay.
Progressive disease. But I think one blessing or one good thing about Parkinson's is it's a slowly progressive disease. You do not see any sudden changes in the symptoms,
Okay.
They just creep in and give you enough time to mentally prepare for that and physically prepare for those symptoms.
Okay.
I think, financial insecurity and the anxiety about the future are the main concerns people have got, including myself.
Okay.
So, one of the coping mechanisms that I evolved is that, uh, and Parkinson's has taught me also this thing, not to worry too much, live by the day, live in the present, to not think too much about the future.
Mm.
Future is uncertain for everyone, so I do not want to kind of, go through my pains twice, once anticipating them and once I actually get them. I will as well, face them when I get the pains.
Yeah. Yeah.
And
Right.
I give myself 10 minutes every day for, people say you should be 100% 24 hours, positive and all that, which is not humanly possible. And sometimes what happens is when we get a negative streak, then our family members will make you feel guilty for feeling negative about things.
Okay. Okay.
But so the way I deal with it, I give myself 10 minutes every day to, for self-pity, for anxiety, any future anxiety, anything more than 10 minutes. I tell
Okay.
myself, this is for tomorrow. Do not think of it today.
Very true. Very true.
So
Very
instead
true.
of totally, it's the ideal situation, but I'm not capable of totally not thinking about these things. But yeah, but
Right.
I manage by giving myself 10 minutes every day back.
Right. Right. Right.
And I another challenge people face, and is lack of, in some cases, lack of family support or perceived lack of family support.
Okay.
Sometimes, more the cases, I feel family is quite supportive.
Okay.
Your friends, our neighbors, and your community is quite supportive, especially in big cities like Bangalore.
Yes.
So, but one
I
has to cut down one's expectations also.
correct. Correct. This is exactly what Dr. Pramod Pal was saying. A lot of them don't even come for the treatment because some of them think it's a taboo. Some of them think that only men get it and women don't get it. But of course, the prevalence is more in men. That's what he says. But then You say that very beautifully. You put saying that there is support of family, neighbors, friends, and everything, and that's how keeps pushing you.
So I went through that phase and I was very reluctant to share about my diagnosis.
Okay.
Okay. And there are reasons for that, especially in the workplace,
Okay.
because the Parkinson's somehow, generates a kind of phobia in people, oh, you have got Parkinson's. And especially at the workplace, they forget that it's a slowly progressive disease and you may be quite productive for quite a few years. So there is no reason for you to be compromised in your career.
Mm.
But your HR and your manager may not understand that. So there may be good reasons for people to try and hide it in their workplace, but in the social scenario,
You cannot escape.
after the initial hesitation, after my TBAs and the book I published, it became known. And it is not like a catharsis for me. I mean, I've seen that, once it's known to everyone, the pressure and the, anxieties about people knowing about it come down quite a lot. Actually, it helps you in the sense that, like, I walk in my community, but my walk is not, I mean, slightly awkward walk. Sometimes, some dystonia, my hand will be going somewhere, I will be going somewhere else and all that. But the community knows that I have got Parkinson's, so they kind of ignore it.
Okay.
And I am also no longer conscious about these things. So I would suggest that it's better to come out with and share your experiences.
Correct.
So
Correct.
that is what helped me at least, and that is what I think will help people to
Sure.
not be shy or diffident about not sharing.
Yes.
Yeah.
Thank you, Mr. Rajeev. Um, I'll come to Dr. Sujith to close the session with this particular question, where Dr. Pramod can also share us something about this. Tell us about 5 things that can be done to ensure there is awareness about early identification and measures that can be taken to better the quality of life for those living with Parkinson's.
First of all, identification of Parkinson's is important. Many a times it is missed in the initial few years, even with doctors, because the symptoms are very characteristic. If you very carefully see, people become slow, there is rest tremor, there is tendency to fall. So many, sometimes it may come as just periarthritis. So these symptoms has to be identified, and you can do some clinical assessment, preferably by a neurologist who has expertise in Parkinson's. So they can identify the symptoms easily. Young age, sometimes it is challenging because you are giving a bad diagnosis to a young patient. So you need to be double sure that your diagnosis is correct. Sometimes you may go for a fluoropuppet for confirming the diagnosis. Otherwise, in old age and all, we just depend on the clinical signs and symptoms to diagnose Parkinson's. So once the diagnosis is made, then how to treat? Because initially we go very slowly with medicines, and initial few years usually you can very well control the symptoms with medicines. But later on, the things become quite difficult because you have a lot of symptoms coming and a lot of complications due to the medicines also come in. At that time, it becomes challenging for the patient as well as for the treating physician. Then you can involve other paramedical person like physiotherapist, speech therapist, uh, especially and social worker to support the patient and the family. Financial problem also can arise because the treatment become quite expensive in advanced stages of Parkinson. Loss of job may be a important concern. So all social issues associated with emotional inability to cope up with the disease, all this also come into play. So all this has to be addressed separately so
Okay.
that they can have a better life.
Right. Thank you, Dr. Sujith. Dr. Pal, if you could close this session with your comments on bringing up awareness and how do we improve the quality of living?
Yeah, so I, as Sujith has already covered most of the things which I wanted to tell.
Okay.
Awareness is that the doctors has to reach out to the community and have a lot of camps as well as early detection of Parkinson's disease, not only for treatment but for detection of the disease. Yeah,
Right.
And then other thing is that when you identify a patient of Parkinson's disease, we need to counsel the patient and the relatives the realistic outcomes, which also Mr. Rajeev told, the realistic outcomes of the disease, of the treatment, medical treatment, of the surgical treatment, when the treatment is required, what are the possible side effects, whether you want to have side effects with the medicines which may just control your tremor just only for about 10-15% of the time a day. Okay.
Right.
So a realistic outcome and counseling is very important, explaining the side effects of all the medicines. By and large, as Dr. Sujith also told, that in the initial stage of Parkinson's disease, there may be plenty of drugs available in the market of different mechanisms, but in the early stages of Parkinson's disease, only one medicine may be suffice, and it need not have multiple of medications because it is available in the market. This is one of the because we have found that really patients develop psychiatric side effects, patients develop low blood pressure because of excessive medications, which is not required in the first time. So sometimes we have to cut down on most of the medications to prevent the side effects. So the doctor has the sole responsibility after diagnosing to educate the patient and the caregiver with the realistic outcome of the disease, the side effect profile of the medications. Most of the medications started in a very, very gradual way. There is no, just one day you give a medicine, everything is fine. The next day you start taking the medicine. The medicines has to be gradually escalated over a month. Otherwise patients develop nausea, vomiting, side effects, and they stop the medicines. They go to the other doctor. So this is like a vicious cycle. So these are the things we need to teach. And we have a Parkinson's Society in Karnataka also is there, and in probably Sujith's place, Mumbai, everywhere. So we need to have more liaison with these societies, NGOs, and bring the information to the public. What is Parkinson's disease and how it can be treated, and what are the modes of treatment, and when you need treatment. Okay, and what are the side effects. So these are the things which I would to emphasize, and also the other people should know that all that shakes and slowness is not Parkinson's disease. There are many different type of so-called Parkinsonism, which can be sometimes treated, which sometimes most of the time is not treated. A medicine which is a gold standard for a Parkinson's disease may be nothing for a patient who has a similar type of Parkinsonism called multiple system atrophy or progressive supranuclear palsy. So they should not compare with each other. The doctor is the best person to confide in and to explain the prognosis. And finally, the last thing is that there are a lot of myths about Parkinson's disease, which has to be taken care in the society. Okay.
So thank you. That's really important
and
points.
One more thing, just may I tell you one more thing is that there are a lot of drugs which are indiscriminately used in the community to treat gastric problems, to treat psychiatric problems, etc., which can cause a so-called a Parkinsonism. Okay, and people mistake it for Parkinson's disease. So those type of drugs or medicines which can cause Parkinsonism should be avoided in the community.
Right. So, doctor, you also mean that over-the-counter people go and pick up few medicines if they want to.
Sometimes the gastric problems are not. They do not cause Parkinson's disease, but they cause a type of Parkinsonism, which which can be very difficult to treat sometimes.
Right. That's really insightful. Thank you for that entire conversations that we had. We have one last question before we close in another 2 minutes. My colleague has asked a question, Mr. Rajeev. The question is directed to you. Please tell us about the response your book has received among people living with Parkinson's disease. Are there enough conversation among the community members, caregivers, and society at large regarding the Parkinson's disease?
So, if you mean by response that how many copies are sold, then because Jana of the book and not many, but whosoever has read the book, many patients have come back to me, telling that reading your book, we felt that you're telling my own story. So that connect is there. Many people with our diseases are like cancer and other chronic diseases have come back to me and talk to me about their own issues, about their own problems. So that way the response has been terrific.
Okay.
I would like more patients to come out and talk, because when I wrote the book, I wrote the book because I could not get any book from any Indian patient. I think there are a lot of social factors that make the responses in different cultures different from each other. Like I could get a lot of books from the US patient, and I read many of them. But that connect does not happen unless you get with your own, socio-cultural background.
Exactly.
That said, Kumar, and I would also like to, add to the improving the quality and all that 1-2 points, if you allow me.
Yeah, please go ahead. Please go.
So, other than the typically talked about exercises and, meditation, socializing, diet, etc., physiotherapy, I think 1 or 2 points I would like to make.
Sure, definitely go ahead.
Number one, go to the right doctor. Okay. Many times we take it lightly and we go to any neurologist who is available nearby. If possible, go to a movement disorder specialist. Even if you have to travel some distance, it is worth it, because after all, in Parkinson's, you go to the doctor once in 3 months or once in 6 months. So it's worth traveling some distance to go to the right doctor, because they have the right experience, the right training to treat you. Okay. Number two, and I know it may be a little bit controversial, but especially in the initial stages, I have seen many people go for alternative treatments like Ayurveda and homeopathy. I'm not discounting that, but I'll request people, not to totally depend upon them. Take them as a complementary medicine, and do not take as an alternative to allopathy, at least for Parkinson's. I've seen in some cases that conditions became so bad that it became challenging for the allopathy doctor also to rescue the patient from the severe symptoms that they are experiencing.
Okay.
Number three, don't underestimate the socializing part. Socialize. I mean, that is, as far as the depression and other, psychological problems are concerned, more you socialize, more you open up, less you will be prone to isolate yourself.
Very true.
So I just wanted to put across these 3 points which are not generally discussed.
It's really insightful, Mr. Rajeev, because definitely when global audience watch this entire webinar session in a few weeks, I'm sure these are the points that they will be taking into consideration. We are at 1 minute to close the session, but we have one question. May I ask the permission of Dr. Pal and Dr. Sujith? Yeah. Can I take this question?
Sure.
Quickly, it is there on the chat box. While Parkinson's disease is often associated with much older people, there is also the young onset Parkinson's disease, that is YOPD, seen in people in their mid-20s, early 30s, that can potentially affect their career and life at a crucial juncture. How do they, as in the youngsters, young patients, the people with Parkinson's, battle it out?
Yeah, so it is really, as I told you earlier, that the age of onset of our patients is much younger, and we see a lot of patients of less than 40 years who started with Parkinson's disease. Okay. Many have a genetic cause. Battling is really difficult because they have another 40, 50 years of their life, and especially with the caregivers, the young, spouse. So we try to help them as much as possible, but they have to, the workplace environment should be more congenial for helpful for them. The employers should understand their problem, and there are certain assessment scales to give them disability certificates, but that is not the end. If a person with age at the age of 45 gets a disability certificate, he may get just a meager amount of money and nothing else. So we need to improve their treatment, and they're challenging. The treatment for young onset Parkinson's is very challenging than the elderly, because they can develop a lot of motor fluctuations like dyskinesias. So the government has to come forward. They have to give cheaper or concessional rate deep brain stimulations. And that is the most important thing. Nowadays, the deep brain stimulation is available where the lifespan of a deep brain stimulation is about 15 years if they're rechargeable batteries. So if a patient develops Parkinson's at the age of 40 years, by the age of 45 years, if they need a deep brain stimulation battery. So, but they may have to give about 15 lakhs of rupees to 10 to 15 lakhs, which is very difficult. So I think the government, as well as the NGOs, as well as the employers and the insurance companies should take up this issue, and the cheaper deep brain stimulation batteries should be offered to them, and definitely their life will be much better, and they can continue with their work and their family life for a long time.
Right. Thank you so much, Dr. Pal. Dr. Sujit, just one thing we wanted to know: how important is blood pressure management in people with Parkinson's disease? If you can just throw us some light on this, and then we conclude this session.
Actually, blood pressure tend to comes down in Parkinson. Parkinson itself can cause lowering of blood pressure, and most of the medicines that are used in Parkinson's cause lowering of. So, if the patient is on antihypertensives at one particular point, you will have to withdraw these drugs because blood pressure can drastically drop down, especially when they stand up. This is called orthostatic hypertension. They present with dizziness, blurring of vision, sometimes actual loss of consciousness. So you have to monitor the blood pressure in sitting or lying position and standing position to see whether there is a fall in the blood pressure. And if it is there, first thing to do is to withdraw if there are any antihypertensives they are on. Then later on, you have to give some medicines to increase the blood pressure also, increasing the salt intake, increasing the water intake, elastic stockings. All this can help with blood pressure management.
Right. Thank you so much, Dr. Sujit, Dr. Pramod, and Mr. Rajeev for taking time out for this wonderful interactive session today from Happiest Health. Thank you so much.
Thank you.
Thank you.